Hello, and welcome to this guide on understanding a CBC report. It means complete blood count.
A CBC is one of the most common blood tests used to assess overall health and detect a variety of disorders, including anemia, infection, and other diseases. Let's dive into each component of the CBC and what it means.
Let's start with the hemoglobin, also called HB or HGB. The purpose of hemoglobin is to measure the oxygen-carrying protein in red blood cells.
The normal range of hemoglobin is between 13 to 17 grams per deciliter, but it is different in men, women, and children. For men, it is between 13.8 to 17.2 grams per deciliter.
For women, it is between 12.1 to 15.1 grams per deciliter.
And for children, it is between 11 to 16 grams per deciliter.
This range can vary from lab to lab as per the method of report study.
Now let's learn the abnormal levels of hemoglobin.
The high level of hemoglobin may indicate dehydration, smoking, or high altitudes.
And low level of hemoglobin may suggest anemia or bleeding.
So this was the hemoglobin in the CBC report. The second component in CBC is the total leukocyte count, which is also known as WBC, white blood cells.
The purpose of WBC is to measure the total number of white blood cells in your blood. The normal range of WBC in blood is around 4,000 to 10,000 cells per cubic mm.
The high levels of WBC in blood is called leukocytosis.
The low levels of WBC in blood is called leukopenia.
High levels of WBC or leukocytosis may indicate infections, inflammation, stress, or immune system disorders.
While low levels of WBC or leukopenia could suggest bone marrow problems, autoimmune diseases, or viral infections.
This white blood cell has a further 5 types, which is called differential leukocyte count, or differential WBC count.
Let's break down the types of WBCs. The types are neutrophils, lymphocytes, monocytes, eosinophils, and basophils. The first one is neutrophils. The purpose of neutrophils is to fight against bacterial infections.
The normal range of neutrophils in total WBC is between 40 to 80%.
High level of neutrophils in the blood is called neutrophilia. It may indicate infection, injury in any part of the body due to bone fracture, or burns, inflammatory disorders such as rheumatoid arthritis, medicines such as corticosteroid, blood cancer called leukemia, emotional stress, smoking, and sometimes in excessive exercise. These conditions show high levels of neutrophils in the CBC report, which eventually increase the WBC in blood.
The low level of neutrophils in blood is called neutropenia. It indicates certain types of infections such as dengue, cancers, autoimmune diseases, and nutritional deficiencies.
The second one is lymphocytes. And the purpose of the lymphocytes in the blood is to fight against viral infections and produce antibodies which will help in future to detect this virus again. The normal range of lymphocytes in total WBC is between 20 to 40%.
The high level of lymphocytes in blood is called lymphocytosis. It may indicate that the body is having some kind of viral infections such as tuberculosis and syphilis, or certain cancers like leukemia and Hodgkin lymphoma, medicines like anticonvulsants and corticosteroid, severe allergic reactions and in condition like chronic smoking, and these lymphocytes are fighting against it.
The low level of lymphocytes in blood is called lymphocytopenia or lymphopenia. Just like neutrophils, the low level of lymphocytes are seen in infections, cancers, autoimmune diseases, and nutritional deficiencies, and it is also seen in blood disorders.
The next one is monocytes. The purpose of monocytes is to help remove debris from infections or damaged cells. The normal range of monocytes in total WBC is between 2 to 10%.
The high level of monocytes in blood is called monocytosis. It is generally seen in skin infection, typhoid, COVID-19, and in blood disorders such as sickle cell anemia, autoimmune disease such as rheumatoid arthritis and lupus. Monocytosis is also seen in pregnancy, and in splenectomy, which means surgical removal of spleen.
The low level of monocytes in blood is called monocytopenia. It is seen in bloodstream infections, chemotherapy, bone marrow disorders, burn injury, HIV, and GATA2 deficiency.
The fourth one is eosinophils, and the purpose of eosinophils is to respond to allergies and parasitic infections. The normal range of eosinophils in total WBC is between 1 to 6%.
The high levels of eosinophils in blood is called eosinophilia, and it is seen in allergic conditions due to certain food items, dust, drugs, and allergic asthma, and the parasitic infections such as malaria, scabies, toxoplasmosis, and certain others.
The low level of eosinophils in blood is called eosinopenia, and it is usually not a threat to your health. However, it is sometimes seen Cushing syndrome and sepsis.
The fifth and the least common one is basophils. Basophils are usually at the level 0 to 1.
But when it is seen, it is generally involved in allergic reactions and inflammation due to pollen or snake venom. And this increased level of basophils in blood is called basophilia.
So that was the differential leukocyte count.
Next we see in CBC report is absolute leukocyte count.
The difference between differential leukocyte count and the absolute leukocyte count is that the differential WBC count is in percentage form and the absolute WBC count is in numbers. So we are not wasting time in repeating the same thing.
So without stretching this video, let's move on to the next component of CBC. And it is RBC count. RBC means red blood cells. The purpose of RBC is to measure the number of red blood cells in blood, which carry oxygen.
The normal range for RBC in blood is between 4.5 to 5.5 million per microliter. However, it is different in men, women, and children, just like hemoglobin, because hemoglobin are present on the surface of RBC. That is why they both go together in most criteria.
For men, it is between 4.7 to 6.1 million.
For women, it is between 4.2 to 5.4 million per microliter.
And for children, it is between 4.1 to 5.5 million per microliter.
Now let's see the abnormal levels of RBC. The high level of RBC count is called polycythemia. And the low level of RBC is called anemia.
Polycythemia may indicate dehydration, heart and lung disease, chronic tobacco chewing, genetic disorders such as polycythemia vera, sleep apnea syndrome, or high-altitude adaptation.
And anemia or low level of RBC could suggest blood loss, nutritional deficiencies, or chronic diseases such as chronic kidney disease, cancer, ulcerative colitis, and rheumatoid arthritis.
Now let's see, what is MCV? MCV stands for mean corpuscular volume. The purpose of MCV is to measure the average size of red blood cells.
The normal range of MCV is between 80 to 100 fluid. The high level of MCV is called macrocytic. And the low level of MCV is called microcytic.
High MCV could indicate vitamin B12 or folate deficiency, while low MCV often suggests iron deficiency, anemia, or certain chronic disease.
Next is MCH. It stands for mean corpuscular hemoglobin. The purpose of MCH is to measure the average amount of hemoglobin per red blood cell.
The normal range of MCH is between 27 to 31 pg. The high MCH may indicate macrocytic anemia, while low MCH often linked to iron deficiency anemia.
MCHC, it stands for mean corpuscular hemoglobin concentration. The purpose of MCHC is to measure the average concentration of hemoglobin in red blood cells.
And the normal range of MCHC is between 32 to 36 grams per deciliter. High MCHC could indicate spherocytosis or other conditions. And low MCHC often linked to iron deficiency anemia.
Next is HCT. It means hematocrit. Hematocrit measures the proportion of red blood cells in your total blood. The normal range of HCT is 40 to 50%.
For men, it is between 40.7 to 50.3%.
For women, it is between 36.1 to 44.3%.
And for children, it is between 32 to 44%.
High hematocrit level may indicate dehydration or polycythemia, while low hematocrit level could be a sign of anemia or vitamin deficiencies. In short, hemoglobin equals RBC equals hematocrit in majority of the cases.
Next is RDWCV. It stands for red cell distribution with coefficient of variation. Purpose of RDWCV is to measure the variation in the size of red blood cells. The normal range of RDWCV is between 11.6 to 14%.
And other is RDWSD, which stands for red cell distribution with standard deviation. Just like RDWCV, RDWSD also measure the variation in the size of red blood cells. The normal range of RDWSD is between 39 to 46 FL. High level of these both RDW suggests mixed anemia or a variation in cell size due to conditions like iron, B12, or folate deficiencies. It helps in accessing the iron deficiency anemia at ERI stage.
Now that we are done with the RBC indices, let's move on to platelets indices.
Let's start with the platelet count. The purpose to count platelets is to measure the number of platelets present in total blood, which help with clotting.
The normal range of platelets count is between 150,000 to 410,000 per microliter.
The high level of platelet count is called thrombocytosis, and the low level of platelet count is called thrombocytopenia.
High level may indicate inflammatory disorders such as rheumatoid arthritis, sarcoidosis and inflammatory bowel disease, infections such as tuberculosis, or certain cancers especially lung, breast, and ovaries, and in removal of spleen.
While low level could suggest bleeding disorders, bone marrow issues, medications such as heparin, antiplatelet therapy, infections such as dengue, pregnancy or autoimmune diseases, and splenomegaly.
Next is PCT. PCT in platelets indices stands for platelet crit. Just like hematocrit measures the proportion of red blood cells in your total blood, platelet crit measures the proportion of platelets in your total blood.
Now we have MPV. MPV stands for mean platelet volume. The purpose of MPV is to measure the average size of platelets. The normal range of MPV is between 7.5 to 11.5 FL.
High MPV indicates larger, younger platelets, often seen in bone marrow recovery. Low MPV suggests older or smaller platelets, possibly linked to bone marrow disorders.
And the last is PDW. It means platelet distribution width. The purpose of PDW is to measure the variability in the size of platelets in your blood. The normal range of PDW is between 25 to 65 FL.
The high levels of PDW may indicate vascular disease, certain cancers, diabetes mellitus, cardiocerebrovascular, and respiratory disorders.
A CBC report provides vital information about your overall health and helps detect various conditions.
However, interpreting results in the context of symptoms, medical history, and additional tests is crucial. Always discuss your results with your healthcare provider for a complete assessment.